Hey everyone, so we're going to continue with the third part of our study of the effects on social and cognitive development by talking about the role that trauma and the possibility of resilience play in development. So as we've discussed, the ways in which our experiences and the people around us, um, act, impact our own social and cognitive development. And issues of trauma and deprivation, so not getting the things that you need, have huge impacts on individuals who experience these events. And these could be potentially over the course of a lifetime, even if they are no longer in those situations, causing them trauma in the present sense. And it is often our reactions to these events in our past and the ways in which we work through these events that determine our ability to continue normal development and to live in a positive manner and stable fashion. And I just want to underline how we work through these events because that can oftentimes determine whether that normal development continues. So, first, we're going to talk about deprivation. And a child suffers deprivation when their basic physical, emotional, and social needs are not being taken care of. Sometimes this can be called neglect. So, this could include an unsuitable diet due to poverty or parental ignorance, inadequate attention from parents who are struggling with their own issues. Um, the next one, lack of a primary caregiver in the first 3 years, and being placed in an otherwise supportive institution if it has a high turnover of caregivers. So for instance, if you are in a foster care system and it keeps being turned over and over again, then that might be, something that deprives you of the needs that you have. And deprivation is in critical periods of development, so times of special importance and greater amount of growth for the brain. And I'm just going to cross out is and put in um, because that's an important distinction. So deprivation in critical periods of development is believed to damage the development of psychological functions irreversibly. Because those critical periods and for those particular growth areas, you may never be able to grow in those areas again after that period of time. And if deprivation is occurring at the same time, then it might really impact you long term. And it shows that the effect of deprivation on human development is often dependent to a large extent on the timing of deprivation episodes. And so some feel that if a psychological function is not formed during a critical period, that it may be not be formed ever. And we watched a few months ago the Jeannie the Wild Child clip. And Jeannie the Wild Child was someone who was tied to a potty chair for 13 years of her life and was not taught language until she was 13 years old. And she was never able to fully form the ability to talk English fluently and grammatically in the ways that we would understand it. And so what we can surmise from this is that she had possibly passed her critical period for language. And for ethical reasons, there are only two possible approaches to studying deprivation. The first is in animal studies, and then also in case studies of children who have gone through deprivation outside the field. And that would be what Jeannie the Wild Child went through. Now, in terms of the effects of deprivation, it can lead to a few things. So it can lead to physiological changes, first off. CT scans have shown that brain sizes of 3-year-olds who had suffered deprivation were significantly below average in size. And then also cognitive impairment and attachment disturbance. And we're going to talk about attachment in just a second here, but in terms of cognitive deficits and attachment disorders, these were most found in those who had been living in deprivation, including severe malnutrition, and had extended for more than 2 years of their lives. Um, And attachment disorder is a lack of preference for adult caregivers and not turning to them when feeling afraid or anxious, showing a lack of attachment to other people. And these could be potentially reversible, even though they're very difficult to do. So the first study we're going to look at here is one of the first studies on attachment, but it really looked at deprivation as well. And so this is Bowlby, 1944. And Bowlby's aim was to test the maternal deprivation hypothesis by looking at a delinquent population. And by delinquent, they mean kids who had been in juvenile facilities, and whether separation had been experienced, and this was to examine the potential subsequent effects of deprivation. So Bowlby interviewed 44 juvenile delinquents who had been caught stealing from a psychiatric facility, and they did not steal from the psychiatric facility. They were caught stealing and then sent to a psychiatric facility. And then also 44 controls who were at the facility but who had not stolen anything. And Bowlby interviewed the children as the psychiatrist. So not only was he researcher, but he was psychiatrist. And we'll talk about the possible ethics of that as we go. And he also interviewed the mothers separately. And he wanted to diagnose potential affectionless psychopathy, lack of affection for or empathy towards others. He was also wanted to establish whether they felt a lack of guilt or shame at their actions, and that informed the diagnosis that he had. And then families were interviewed to determine whether the thieves had prolonged early separations from their primary caregiver in those first 2 years of life. So the results were that of the 14 thieves diagnosed as psychopaths, 12 had prolonged separation from primary caregivers for 6+ months before the age of 2. And of the 25 thieves not diagnosed with this, only 5 were separated for 6+ months before the age of 2. And so these seem to indicate that if a child has experienced early separation from the primary caregiver for more than 6 months, then the chance that they will become delinquent is greater. If a child has experienced early separation from the primary caregiver for more than 6 months, they're more likely to be potentially developing psychopathy. And maternal deprivation in the end can to some extent explain some of this offending behavior. So next we're going to look at trauma. And trauma is experiencing a sudden and adverse change in circumstances. This could be caused by a few things, including death of a parent or caregiver, war, dislocation as a refugee, abuse, whether that's physical or sexual abuse. And the effects of this trauma are not always distinguishable from the effects of deprivation, because trauma often involves deprivation. Not getting the things that you need are often caused by trauma, whether that's caused by your primary caregivers or those around you or not. And, as it says here, deprivation can also follow trauma like the death of a parent, because you don't have that person around anymore. And cognitive and attachment behaviors for trauma are often indistinguishable also from deprivation. And trauma can also be brought about by a one-off traumatic event. These are called adverse childhood experiences. And this could include anything from your parent losing a job, the death of someone in your family, witnessing a crime, like witnessing a murder would be extremely traumatic for anyone, but especially for a child. So in terms of the long-term effects of trauma, we have quite a few here, as you can see, but I'll just go over some of the major ones. So one could be problems in school, like behavioral issues, lower IQ and or cognitive functioning, increased sexualization, especially those who have experienced abuse. Because studies have shown that there's a correlation between abuse and a higher number of sexual partners, which can lead to other sexual effects, including pregnancy, HIV infection, STD infections. as well. Attachment disorders, which may result in more aggressive behaviors. Um, Also, victims of abuse are more likely to be arrested for serious crimes as juveniles and as adults. Um, and we have several statistics down here that sort of show the long-term effects of trauma and how not getting help can potentially lead to some really drastic effects. Now, in terms of PTSD, and I know this comes up a lot because especially with the ties to either veterans, soldiers, or other people who have experienced traumatic events have also gone through PTSD. Um, this is the this is based and caused by the sudden nature of trauma, and that can lead to post-traumatic stress disorder. And scans of those with PTSD have shown symptoms of decreased hippocampal activity. And we've talked about the hippocampus um, before, and it plays a role in the creation of new memories. And so poor memory skills may be part of it. Also, feelings of isolation, emotional flatness are all, affected as well. And this could be triggered by sounds, smells, other sensory input. It may lead to things like hypervigilance, where they feel that they are in a state of tension, looking for triggers, which makes relaxation very difficult. So that trauma really impacts the rest of their lives in a lot of cases. So in terms of the next study, we're going to look at McFarlane 1983, and she wanted to investigate predictors of PTSD symptoms in children who survived a natural disaster. So there was a bushfire in Australia in 1983, and 808 families who were affected took part in this study. Data was collected from interviews of teachers and parents on children, and the interviews took place 26 months after the fire. And during the interviews, both the children and the parents were scored for symptoms of PTSD. So what they found was that there was a positive correlation between PTSD symptoms in children and their parents. So if the parents had it, the child was more likely to have it. And these symptoms 26 months after the fire were best predicted by variables like separation from parents after the fire, right? This is traumatic. Not only have you possibly lost a home or property or been forced out of your home, but you're also separated from your parents now. And then also the continual maternal preoccupation with the fires, obviously from the mother, also led to greater symptoms of PTSD. And then also factors that were even more powerful included the degree of exposure to the fire or the amount of losses suffered by the family. Whether that's property, whether that's people, all of these things could sort of impact whether the person had PTSD. If the fire was miles away and you were getting out of the house and got out of the house before anything around you really burned, that could be, a lot less traumatic, I guess, in some ways. So the conclusion was that when parents demonstrate resilience and they model that positive behavior in terms of stress, it becomes a factor of resilience in children. And you can also use this one for social learning theory because the parent and the people around them are demonstrating resilience for the children. Now, one effect of PTSD is an increased likelihood of heavy drinking and drug use. And this could not always be legal drugs. It could be alcohol. It could be painkillers, prescription medication. But psychologically, the use of drugs is a defense mechanism for the trauma and mental pain the individual has faced. And so therapy, treatment, replacement of the systems that led to this addictive behavior is necessary to overcome this continued substance abuse, to become more resilient to this trauma they faced. There's also a potential for somatic problems, and these are, sleep disorders and also physical issues. So children who experience childhood trauma appear to be more likely to be obese when adults. This could be also a defense mechanism, like they're using food as a um, source of comfort. I know that when I've watched a show like 600-Pound Life, which follows people who, are 5, 6, 700 pounds, a lot of times their eating started when they faced an abusive or neglectful, or there was a divorce in the household, something to make them feel better. And that just, sort of spun out of control. And those are obviously very extreme cases. It could also be used for people who have been sexually abused as a desire to put up a barrier to sexual attention. If I eat too much, if I gain a lot of weight, then maybe they won't want to pay attention to me. And it may also be a reason for them to feel like they want to be more visible. They want to feel like they can stand up to their attackers. All of these things could lead to possible sources for obesity. And then sleep disorders, this can occur both in childhood and into adulthood. It could be a result of staying alert to avoid abuse or because of high levels of anxiety due to possible trauma. Now, in terms of resilience, because, a lot of people go through traumatic events, and sometimes it's how we work through these things, either for ourselves or for others, that determine where our behavior and where our lives go from there. And so this is where a person successfully adapts to a problem conditions or to a difficult environment. It's the ability to thrive, mature, and increase competence in the face of adverse circumstances, and the capacity to bounce back from deprivation and trauma. And characteristics of these people include coming from members of families that are caring but limited in resources. So if they have that supportive environment at home, that is a factor for doing it. Support of key and trust of the key attachment figures like mom, dad, family, friends. Encouraged to access opportunities for personal and social development like therapy, like an outlet in sports, other activities that may lead to them becoming more resilient and overcoming this traumatic experience. And then also being easygoing, friendly, proactive. This allows for creating cognitive schemas for resilience more readily than the child who is more inflexible or deeply sensitive. And I don't say this to say that some people could never be resilient. As we've seen this year, the human mind is quite powerful and impactful. And so continuing to work through these things and finding sources of help is going to be very, very important. So in terms of resilience, self-efficacy and confidence is also extremely important. Previous successes motivate individuals to be more resilient in other cases and to continue working through this and continue seeing it through to the other side, and to strive towards more fulfilling academic, sporting, and social objectives. Now, how do you build these resilient strategies? Often these strategies for children and adolescents follow on or focus, on resilience in the classroom. So if the child can improve on resilience in the classroom, overcoming disadvantages, that sort of stuff, that could transfer to their outside life. If you're struggling with something and you find ways to overcome that struggle, you may think of yourself or use that and apply that to your own life. Also, growth mindset, the belief that you can change and grow is important as well. And the ability for our brain to be neuroplastic or use neuroplasticity means that if we do not replace some of the cognitive thoughts that we have, that we may continue to do the same thing over and over again. And so having the ability and the belief that you can grow and change is incredibly important. Now, we're going to come back to the Costello um, study from 2003, the Great Smoky Mountains study. And what they found was a source of resilience, in this case, was getting out of poverty. And so having greater resources. Now, is this going to be an ability of all people to have those resources? No, but this is a potential source for resilience, was that these individuals, because of the casino arriving, their family made more and they got out of poverty, and some of the externalizing behaviors were no longer being showed. So that showed some level of growth. Now, they need to also take care of the internalizing behaviors of anxiety and depression that we talked about the other day, which were still being shown. But again, the income level might have been a source of resilience in this case. I think more successful would be the strategies that we talked about a few slides ago, in terms of having that growth mindset, in terms of using things from the classroom to apply to your own life, in terms of overcoming these traumatic experiences that were unfortunately faced. All right, if you have any questions, concerns, want to talk about this topic of trauma and resilience, please come find me. And I hope that all of you continue to become more curious about the role that stress, trauma play in our life, but also the ways in which our bodies and our brains are so resilient that we can overcome through very hard work some of these disadvantages we've been put through. I hope you all have a great day.